chest pain during breathing is common condition. Usually it's benign, but sometimes it requires emergency treatment. We will discuss most common and most important ones. First and most common cause of chest pain during breathing is musculoskeletal pain. It is also called as costochondritis. Probability of this condition is 35% if person has chest pain during breathing, especially if person generally healthy. Pain occurs around sternal region on the chest, and person can indicate where is the pain, and during palpation, when person touches this place, it exacerbates pain. Physical activity also can exacerbate pain, and it's slightly correlated with breathing. It's not very directly correlated with breathing. It's more correlated with physical activity. What is cause of this condition? We don't know. In most cases, we don't know what is the cause. Many cases, it's correlated repetitive movements or physical trauma. What is treatment? Non-steroidal usually is enough to treat this condition. Ibuprofen and naproxen usually is enough. It's benign condition. Another common cause of chest pain during breathing is gastroesophageal reflux disease or GERD. It's a very common condition. It affects around 20% of general population. So it's so common that we should mention about it, even it's not directly correlated with breathing. So for GERD, common symptoms is persistent heartburn or heartburn and pain after eating or before sleep, disrupted sleep, chronic cough, regurgitation of food. But this symptom is not directly correlated with breathing. But many cases, people wrongly correlate them with breathing. That's why we should pay it attention. And it's very common condition. It affects 20% of general population. That's why it's important. What is treatment? Treatment is antacids, H2 blockers, proton pump inhibitors. Third most common cause of chest pain during breathing is anxiety disorders. During anxiety disorders, common symptoms are intense and sudden fear. Fear is important, trembling, palpitations, to feel own heartbeat, chronic worries, maybe lasts more than 6 months. Such chronic worries also happens. And hyperventilation during panic attacks, shallow and fast breathing, and sometimes, and at this case, person can feel chest tightness or chest pain during breathing. That's why it's also common. So anxiety disorder is third most common cause. What is treatment? Treatment is cognitive behavioral therapy, antidepressants, benzodiazepines sometimes, and mindfulness practices such as yoga, for example, or meditation. Viral infection is important. Probability of viral infection is 15%, but it's more common among children. And this viral infection can cause pleuritis, especially influenza virus or cocci virus. Pain is sharp, stabbing, and often one-sided. Fever, cough, and malaise also common. It's strongly related with breathing. So pleuritis is strongly related with breathing. Other disease we already mentioned, such as musculoskeletal pain, costochondritis, gastroesophageal reflux disease, or anxiety disorder, none of them is strongly related with breathing. But pleuritis is strongly related with breathing, and it's usually caused by viral infections. Another common cause is asthma. Asthma occurs in 15% of probability. Asthma generally very common condition. It affects around 10% of kids and around 7% of adults. So this condition generally is very common. It's related with breathing, not directly relation, but Person can have feel that it's related with breathing, and during breathing, chest tightness and chest pain is more prominent. Wheezing, shortness of breath, chest tightness, nighttime or early morning coughing is common. And what is treatment? Treatment is inhaled corticosteroids, bronchodilators, and avoidance of triggers of asthma. Asthma trigger can be cold air, for example, or physical exercise, or different factors, for example, dust. Pneumonia. Probability of pneumonia is 10%. It's directly correlated with breathing also. So pleuritis and pneumonia is directly correlated with breathing, and pain increases with breathing. Other symptoms include productive cough, high fever, shaking, chills, malaise, and breath-related chest pain. It's important symptom. It occurs usually among kids and elderly whose immune system is not fully strong, and pain worsens with deep breath. It's important. Treatment is antibiotics if it's bacterial infection, non-steroidals if it's viral infection. If it's fungal infection, then antifungals are needed. Another common cause, not common but very important cause, is pulmonary embolism. Pulmonary embolism is less common among healthy population. It's more common who has deep vein problems, and traumas from deep vein can cause pulmonary embolism. It is characterized by sudden chest pain, shortness of breath, coughing up blood. Pain during breathing is strongly related also here. So it's important. Sudden chest pain, shortness of breath, coughing up blood, pain during breathing, and if person has vein problems, it can be pulmonary embolism. But in healthy population, it's rare. Usually it occurs among older population. Anticoagulants, thrombolytics, and surgery sometimes is needed, and is emergency situation and needs urgent treatment. And coronary artery disease such as angina also can cause chest pain during breathing, but it's not directly correlated with breathing. This pain is more constant in nature. It's strong pain, pressure-like pain. Patient cannot indicate exact point where this pain is, and during palpation this pain is not exacerbated, and this pain also usually related with physical activity. So during rest person feels better, during physical activity chest pain increases. It can be coronary artery disease. Causes of course include unhealthy lifestyle such as obesity, unhealthy diet, and sedentary lifestyle, smoking. Atherosclerosis is most important risk factor. That's all I wanted to say. So to summarize, most benign and most common cause are musculoskeletal pain. Also, it's common during anxiety disorders and gastroesophageal reflux disease. In children, it's viral infections and pleuritis. In children, again, it can be pneumonia. Also in adults also, but more common among children. Asthma also in both children and adults, and in rare cases it can be pulmonary embolism and coronary artery disease. Thank you very much. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.